Everyone, today we're talking about pipettes. Woohoo! First, we're going to talk about the mechanical pipettes that you see in front of you right now. All right, looking at these, if you notice on the side, they are talking or displaying the range of volumes that they're able to pull up into the pipette tip that is used on the end. The pipette tips are plastic and they're disposable. They are not to be cleaned and not to be reused. They just immediately go into the trash. Depending on what you have pulled up into them, would decide whether you put them into the regular trash or the biologic trash. If it is a biological agent that is a source from animals or humans, you would put it in the red trash can. If it's just water, like we do in the Intro to Clinical Laboratory Science class, then you would put it in the regular trash because we're not using anything biohazardous. Okay, so let's talk about these. If you look at the tips, seeing the tips also indicates how much of a volume that you would be pulling up into the pipette itself. So smaller the tip, smaller volumes. Larger the tip, larger volume, okay? If we were to look at the tips that go on here, the one all the way on the left would use this one. It looks kind of big because that's perspective. Look at that. Going closer, it's very tiny, okay? As opposed to this grandfather tip goes over to this one here. So see the difference? You're able to pull up different volumes. All the pipettes that we use in this laboratory and in most places, they are to deliver pipettes, which means that they pull up an amount that is labeled for the pipette or calibrated for the pipette, but they the main point is that they deliver that amount. Some of them may be blowout and some of them may not. And we're talking about blowout pipettes when we talk about the glass pipettes that we're going to get to. Okay, but for now we're going to talk about the mechanical ones. All right, so if I'm just going to pull up this middle guy right here, okay, notice it's 20 to 200 microliters. Okay, the little U is the micro sign and the L is the liter. All right, looking at this, currently I am at 100 microliters. There is no decimal on this one. There is a decimal on other ones, okay? This is the smaller one. All right, so you can adjust the level or the amount of volume that gets pulled up. This goes up to 200, so no matter what way that we go, we're not going to hurt this pipette. So going towards you means that you're going up in volume. Going away from you means that you are going down in volume. Let's stick at 100, okay? All right, so this is a 20 to 200. So if we were to look at the type of tips that would go with this, we would want something that goes up to 200, and this one does. So let's put the tip on. Okay, it's not going to go all the way up. All you do is you hold the pipette itself by the body and you place the tip on with clean, dry hands. So that would be with gloves on, clean, dry gloves, and a clean and dry pipette tip. If it fell on the floor, don't use it, okay? All right, so what we would then do is get the liquid that you may want to pull up. Just so you know, in the normal procedures in the lab, you're not going to get colored water, but that's what you see online. And for this practical purposes, I want you to be able to see what I'm doing. Okay, so I have a beaker here full of colored water. If I were to read how much colored water was in here, I would go to eye level, stick it on a level surface, and you can see that is up at 350 milliliters, okay, because of the graduations. We'll talk about glassware later, but that is reading it at the bottom of the meniscus, okay? So now let's go and try to do this where we can see it very well. Okay, so if I'm pulling up fluid, first, if I'm using this, I check the amount, okay? Make sure I've got that wonderful, nice, clean, dry pipette tip on there. All right, now I put my thumb at the top here, okay? This is an ergonomic setup, all right? You want to have it resting on your fingers, okay? The rest of your hand, not your thumb. And then you're going to use your thumb to press down, okay? And what we're doing is creating the ability to have suction. So before I even put it into the water, I'm going to press down, all right? When you look, when you pick this up yourself, you'll note that there are two different stopping points of these mechanical pipettes. So the first one where it causes you to have a lot of tension, that's the first stop. And then the second stop is below that, and that's when you're dispensing, okay? That's the only time you're gonna use that. So when I do my first stop, when I pull up, that's going to allow the suction to happen where the fluid would go up into the pipette tip, all right? You want to do all of this in a very consistent, fluid manner and slowly. You don't want to do things quickly because you don't want the tip of the actual pipette itself to get wet and contaminated, all right? So we're going to go in with it already pressed to the first stopping point. We're going to pull up the fluid. Now this could be better. All right. So I've got it down to the first stopping point, okay? I'm going to charge the pipette tip, meaning, see, I haven't depressed yet, meaning that I bring up the fluid into the tip, see that, multiple times in order to charge the pipette tip. All right, so you've seen that part of it. Now I'm going to show you what I'm doing with my thumb. All I'm doing is making sure that the tip is below the water line, the liquid line, and I'm pulling up slowly, okay? And going like this. That's all I'm doing. All right, so I've charged it. It's below the level of the top of the water, and I'm pulling up. So now I have fluid, no bubbles. Then I'm going to dispense, all right, and put it at the side. And that, I went all the way to the stopping point again. I haven't depressed it yet, okay? Still have that there. There is a little bit still in the tip, okay? So if you went all the way down, that is full dispensing, okay? Now I'm gonna pull back up because I can rest, no big deal, all right? I'm not pulling anything up and nothing's left in there. In these type of pipettes with the mechanical pipettes with the disposable tips, you do not wipe them, okay? Notice I did not wipe when I went out of the water, okay? So now I have that little tiny bit, the 100 microliters in the bottom of that tube, okay? So now what I would do is, I don't want to contaminate anything else. I did touch the inside of the tip to the inside of this receiving tube. So what I'm going to do is eject it by doing this button right here, and it's going to eject the tip, okay? This is water. It doesn't need to go in biohazard But if you were on the normal bench, that is what you would do, because we use these in class with real specimens, okay? So let's try a different one, all right? Let's go for the granddaddy. All right. We're gonna go with the granddaddy. That's actually doing milliliters, not microliters. Notice there's an M there this time instead of that little U, okay? So here, I have it set to 4 milliliters. I want to set it to 5. So I'm going to pull forward towards me. And I'm changing this to 5. Okay. You want it, see that little pointer? You want it directly on that notch that says 5. Okay. These are very accurate. But they're only as accurate as you allow them to be, okay? So I'm taking a nice, clean, dry disposable pipette tip. I'm putting it on top, okay? And now it's on. So there is still space in between the top of the tip and the body of the pipette. It should always be that way, okay? So what we're going to do now, I'm going to try to do this again, one-handed while filming. Woohoo! All right, so again, this one has the same thing. You have the ejection button here, like a fighter pilot. You have the depress here, and then the complete depress, okay? This is the first stop. This is the all the way stop, okay? We only go to the first stop. We're going to put it all the way in below the water line, gently allow a depress, and that brings it up. Okay, pushing back down to the first stop, and I'm charging my pipette. Okay. Let's do it one more time. Oh, we have a bubble. The bubble is on the outside of the beaker because it's a little wet. Okay, so I pulled that up, right? Notice there is a little bit on the outside, okay? If that is the case, you still are not supposed to wipe it, all right? These are meant to not have anything stick to them on the outside. Depending on what book you read versus what online source you read, it might tell you to pull up and go like this to wipe it off. That is up to your facility whether that's okay or not. All right, but I'm going to depress, or I'm going to press again, and I'm going to evacuate underneath. But see, it would still have stuff on the side of it. Okay, so I'm going to fill this up again, and then we're going to put it into that tube. Okay, here we go. So I'm going to press before I go into the water. So press to the first stop, go in, charge, slowly charge. If you charge quickly, you're going to end up with bubbles and a mess. All right, so here we are. Now we're going to put it to the side, and we're going to press down all the way. And there it is. It's out. Okay, we filled it. Now we're going to eject the tip. Okay. All right. So what I want to do now is I want to show you the other pipettes, okay? And then we'll have a separate video about dilutions. All right, hold on just a minute. Okay, with these sets of pipettes, they are the glass pipettes, okay? They include the volumetric, which you see here. It has the little bulb in the middle, or the little blown out area. and see it says 5 milliliters. All right. This is calibrated at 20 degrees Celsius, and it is a to deliver. Okay, like I just told you, all the ones we have in the lab are to deliver. That's volumetric. That is the most accurate pipette. Okay, and it is, all the ones I'm about to show you need this bulb that you squeeze, just like the press that you did on the mechanical one. This one you have to squeeze, and you have to hold everything up completely straight, squeeze, and then remove and put your other hand's pointer finger on top. And you then move the tension of your other pointer finger to dispense the fluid. This is a graduated pipette, glass pipette. Okay, notice there aren't graduations all the way down into the tip. So that means that stopping at that 5 mark is where the accuracy ends. This is not calibrated all the way to the tip. If it were, that would be a serologic pipette. This is a Mohr pipette. Serologic means all those graduations, those markings that you see between the 4 and the 5, they would be all the way down towards the tip. And a lot of those are blowout pipettes, and they would have an extra marking up here. This band that you see is just a manufacturer thing, which tells them what pipette it is that they have made. This one is a graduated pipette also. It's a Mohr pipette. It's very small. Sorry about that. And see, the 9 is here, but it goes all the way up to 0, just like these do. The 0 is up at, where is it? The 0 is up at the top on the graduated that we have here, the Mohr pipettes that we have here, which means that when you bring it up to 0, that's the full amount that is listed. So if on this 5 milliliter graduated Mohr pipette, we'd bring it all the way up to 0, and that would be 5 milliliters. If we brought it only up to the 1, that would only be 4. Whereas on the volumetric pipette that we have in the background here, you bring it all the way up to this line, that is 5, okay? And it only dispenses 5. These you could dispense however many you wanted to within the amounts. So you could dispense 1 milliliter by going from the 0 to the 1 and stopping there. You could dispense 3 by going up to the 0 and stopping down at the 3. Or you could do the whole 5, okay? But you would stop at the 5. All right, so let's try this. So what you're going to do, is you're going to use a bulb, all right, in one hand. You're going to squeeze it, and you're going to put it on the top here. So you would squeeze, put it on the top. You have to make sure everything is dry and clean. That includes the bulb. All right, and I'm gonna try to get us a little bit higher. So I put you all up a little bit higher here. Okay, so even if you're right-handed, you might feel more comfortable doing the left way. If you're right-handed, this is the way you would do it. You would hold the bulb in your left hand. You'd put it on here on the top. I'm aware that you can't see the line. You'd bring it all the way up. See how it's rising up? You are depressing or de-squeezing slowly, so the rise is slow, okay? If I go too fast, it's gonna go all the way up to the bulb. So I missed it because this is not the usual way I do it. I'm right-handed, but I'm actually ambidextrous, and a lot of things I do left-handed in the lab. So notice I missed the mark here. When you would go past the line, and then you would stop with the meniscus, the bottom of that little bubble looking thing, at the line. Okay? So that's why this is hard to film, because I'm all by myself. All right, so I'll let it go. And it drains completely out. If this were, notice there is still some left in the tip. That is not to be blown out. Remember, this doesn't have an extra etching up here, so this is not a blowout. If this was a blowout, I would have a completely depressed bulb. I would put it on top, okay, and I would squeeze. And that would blow the rest of it out that was in the tip, and now it's gone. All right, so let's add another step into this. Okay, if we were to add another step into this, we would use, and I believe you can see, yeah, you can see it, the Kim wipe here. Okay, so in between, when I have brought up the water, this is not the best. I'm gonna switch the view because now I'm gonna be doing it left-handed. Okay, so switching the view here, hopefully you'll be able to see this. I know that I'm not zooming in, and that's very difficult. So I've got the water. This is, again, just colored water. I'm going to hold. You always hold with your hand that's about to come through here. So you're going to hold it, and I'm going to squeeze the bulb with my right hand, put it underneath the water, and just pull it, allow it to come up. See, it's coming up through the pipette here. Glad I didn't choose blue. You wouldn't be able to see it with my gloves. Okay, so notice I'm depressing, not squeezing, okay? So it naturally will fall if I take it away. So let's try again. We'll pull it up. Make sure you're not putting the tip of this at the base of the glassware that you're pulling out of. So I allow it to go up. I'm going to move my hand up there, and then I'm going to put my finger on top. It's very hard to do, okay, especially when you're filming and you're trying to remember everything. All right, so we'll try it one more time. Hey, I didn't get it. No big deal. We'll do it again. Okay, pull it up. I'm not at a very good angle because I'm trying to capture it on video. Okay, so I did it past, okay? I'm going to allow it to go down so that the meniscus rests on the line. Remember, when you're doing this, when you're reading the meniscus, you have to be eye level. Okay, so eye level, it's still above the line. Okay, we're gonna do just a little bit down. All right, so all I did was adjust the pressure with my fingertip, and now it's directly on the line. Okay, I'm going to now hold it with just the one, making sure it doesn't go past the line. Take my Kim wipe, go straight down. Do not touch the tip. If you touch the tip, you're gonna end up removing whatever the fluid is in there and concentrating the solutes that are in this, whatever this may be, okay? And most likely it's calibrator. You're making a calibrator when you're using a volumetric pipette or a standard of some kind, okay? So now that I've done that, I can take and use my other hand, and I can just let it flow into the tube. Again, this is not a blowout, so everything that comes out is all that was meant to come out. The reason we wipe the sides and straight down, I already told you, you don't want to pull out fluid and then concentrate the solute in here. But the reason that we wipe it is so that when it is expressing into the tube, we're not adding extra. Because again, we want something that is extremely accurate, and that is what this kind of pipette is extremely accurate. And you use it on calibrators and standard where you need to have extreme precision and accuracy. The graduated pipettes do not have great precision, okay, and are not as accurate, okay, but you can use these for other things. Honestly, in the medical lab, you're not really using these very often. You're mainly using this to make a calibrator, and then you're using those mechanical pipettes, these guys, for everything else. All right, that's mainly what's going to happen. These are reusable. Notice there's still water in there. All right, I did not blow it out. These are reusable, okay, but you need to clean them in between. So once you use one, that means you gotta make it go away for cleaning. So a lot of times the facility will have multiples of the same volume. Okay, I'm gonna blow this one out because I'm just going to put the water back in there. All right, you wouldn't do that in real life. I'm doing that because I'm gonna put it down here. Okay, now this is a graduated one. Let me see if you can still see very well. Okay, the water is back further. All right, so here we're going to do the graduated pipette. Again, it's not a blowout. This is a Mohr pipette because there is no graduation at the tip. And let's say we want to dispense, so this was 5 milliliters from the volumetric. I'm going to label that. If you're really in the lab, you should label first. 5 mils volumetric. Okay. Now I'm going to label my other tube, and it's going to be 5 milliliters, and this one's going to be more. That doesn't mean 5 milliliters more, so that equals 10. It means that it's the Mohr pipette. Lab humor. Haha. Okay. My kids would be like, Mom. All right. So we're going to do 5. So that means we're going to have to stop at the 5 mark here. Okay. We're going to go above the 0, just like we did with the volumetric. We went about above the volumetric calibrated line, and then we let it fall down a little bit as we were adjusting our finger. So we're going to do the same thing. I'm squeezing, I'm putting below the water, just like we did with the mechanical pipette. It's coming up. It just went past the 0. I'm adjusting my hands, but it fell, okay? So I can then unsqueeze, pull it back up, and then here we are, okay? So I'm gonna let it fall down to the 0. I'll show you all. This falls faster, by the way. The graduateds fall faster than the volumetric, especially the serologic, because it has a wider inside than the volumetric. Okay, so we're going to take that up. It fell below. Do you see that's below the line? So we'll pull it up again. It didn't really look like it, but again, you have to be at eye level. And if you were at eye level, you would see that it was below the line. This is the part where new laboratorians get very frustrated, because they'll be like, yeah, I got it. And then I come over and they've moved their finger pressure And then they're like, it was there. And I say, no, it's not at the bottom of the meniscus. So here, hopefully you can see it's at the bottom of the meniscus. Gonna wipe straight down, and I'm going to let it go like Elsa into the tube. Most people would say to put it towards the side, but that would mean that you can't put it straight up and down. You have to have these straight up and down. Again, not a blowout. There will be contents in the tip. It is a to deliver. All right, now let's check the accuracy of these two. Oh, I realize what I just did. It's not going to be accurate because I went past the 5. Why didn't you stop me? I'm just kidding. Okay, let's do that again. So 5 milliliter Mohr. Things are so different when you're videoing instead of if you were doing them in real life. It's so much easier just to be by yourself and do it. So we'll do it again. It's a learning experience, right? Okay. And I hope you noticed what I did before I said it. Okay. So we're allowing it to fall. It's going down, it's going down. All right. It's at the meniscus. Go straight down. All right, now we're gonna put it, and we're gonna catch it when it gets to the 5 this time. All right, so that means we go slower. If I'm reading it above, like I am standing right now, would I have it falsely elevated or falsely low? For all of you who said, oh, we got it at the right way. For all of you who said it would be falsely low, you're correct. Because if you're looking down, the meniscus is going to look lower than where it actually is. If you're looking up at it, it's going to look falsely higher. Okay? All right, so now let's see if there is any visible difference in the two kind of pipettes that we did. We're going to leave it on a level surface. Volumetric's on the right, Mohr's on the left. Let's see it. How did we do besides the one that was in the back? It looks negligible, doesn't it?